Hi everyone, I am Dr. Mustafa, consultant surgical gastroenterologist and laparoscopic surgeon at Care Hospital, HITEC City. Today I will be briefly discussing you regarding hernias. The most common questions what is being asked from those patients who are having hernias. Usually the two most common hernias what we see is the umbilical hernia and the inguinal hernia. Hernia means a gap in the abdominal muscles. The abdominal muscles start from the chest and they are going up till the pelvis. So they prevent the abdominal contents from falling out. So hernia is like a small gap in it, small gap in the muscles. The gap occurs at those places which are the weakest in the body. In a female patient, the gap commonly occurs at the site of umbilicus because of repeated pregnancies or a pregnancy which is having a very large size baby or any hypothyroidism, short stature. These can cause thinning of the muscles and cause resulting in the formation of a small gap or hole in the abdominal muscles, through which abdominal contents protrude out, or the intestines which are inside the abdomen, they come out. That is called an hernia. Likewise, in male patients after suppose 50 or 60 years of age, the abdominal muscles, especially at the inguinal region. The inguinal region is the area where the leg is joined to the abdomen. So that area is the weakest in the males, especially after 50 and 60 years of age. Thinning and weakening results in the formation of an hernia. That is a hole through which intestinals or abdominal contents that tend to protrude out. The risk which carries with each hernia is, since the abdominal contents are coming out, the intestine especially can come through that hole and they can get blocked. So the intestines can get damaged, the part which is coming out. That is the reason we close that defect and we doesn't allow the intestines to come out. How we close it? How we close it is very important. Previously we used to just close the defect and leave it like that. That is like 20-25 years back. So the hernia used to come again because it was the thinning of the muscles which was causing the hernia. So now what we do is we not even close the defect and we keep a mesh over it so that it becomes a strengthened layer and the hernia doesn't happen again. Nowadays we are doing all those same things, keeping the mesh in laparoscopic surgery, where we don't cut, we don't give any incision. Through a small hole, what we do, we close the defect and we put a mesh over that defect so that it never happens again. We are having very good results with the laparoscopic surgery, where for umbilical hernias and inguinal hernias, we go through a very minimal small cut and through laparoscope, we close the defect, we keep the mesh. And the advantage of this procedure is you no need to get admitted 1 or 2 days before the surgery. On the day of the surgery, you can get admitted and next day you will be discharged. You will be having very minimal pain and we advise you to take rest for 1 week. After that, you can do your routine and normal regular work. Along with it, what we advise is not to lift heavy weights for a period of 2 to 3 months so that you might have pain at the site of the surgery. Apart from that, the results are very good. You will not have any recurrence. You will not have much pain. You will be able to do your normal activities. Thank you.